Body found in Bay is missing teenagers. This was the headline just 2 months after my high school graduation. Next week marks the 14-year anniversary of my classmate's death. Eventually, it was ruled a suicide. In fact, my high school had 4 deaths by suicide from 2007 to 2019. That's an average of 1 death every 3 years. When my family and I were coming of age, nearly everyone we knew had more than one peer who died by suicide. I'm Taylor Binnix. My research focuses on the environmental and social factors that contribute to suicidal ideation and death. My advisors on this project are Holly Wilcox and Paul Nestat, and my project is part of the School Clustering After Recent Suicide study. I'd like to thank the research team on this study for their support with my project. My high school is a suicide cluster school, and my project examines which high schools in Maryland are suicide cluster schools and what we can do to predict and prevent suicide clusters. In this project, we started with identifying deaths. We used death records from the Office of the Chief Medical Examiner of Maryland to identify teens who died by suicide between 2007 and 2019. Then we identified schools. Using medical examiner reports, social media posts, and obituaries, we identified the school the student was attending at their time of death. We found 171 deaths across 98 public high schools in Maryland. Next, we identified point clusters. This is when more than one student from within the same school dies by suicide within a short time frame. We found 14 schools in Maryland with a narrow cluster where more than one student died by suicide within 1 year. We found 32 schools in Maryland with a wide cluster where more than one student died by suicide in 4 years. We looked at the school characteristics of each school that are descriptors of the school climate and student body to identify risk factors of the school for suicide clusters. We used data from the 2019 school report card in our analysis, including items such as star rating, academic achievement, graduation rate, English language learners, college enrollment, and measures of income for the student body. We also added the geographic rurality of the school from the National Center for Health Statistics Urban and Rural Classification Scheme. Most high schools in Maryland fall in large fringe metro areas. The rationale for this study was groundbreaking in the field of research into suicide clusters. We used a novel and robust methodology that combined mortality data and education data. We linked these data sets and mapped the associations between individuals who have died using their school. We performed a rigorous logistic regression analysis to help identify which school characteristics were predictive of suicide point clusters. In this project, we focus on clusters of deaths, not clusters of suicide attempts. Previous researchers have suggested that the context around suicide attempts might be similar as for suicide death. And while overlapping, we know that the epidemiology of death clusters is different. In our analysis, we used a univariate logistic regression to identify which school characteristics were statistically significant at the p is less than 0.1 level for narrow clusters and wide clusters. We took those school characteristics that were significant at the p is less than 0.1 level and entered them into the full models. For narrow clusters, the full model included star rating and geographic rurality. For wide clusters, the full model included students receiving free and reduced price meals and students with economic disadvantage. Here, I will present the adjusted odds ratios of the full models. For narrow clusters, we found that schools with a star rating of 4 compared to schools with a star rating of 1 had a higher odds of students dying within a narrow cluster. In fact, there was a 7 times greater odds of a narrow cluster occurring at better schools. For wide clusters, we found that schools with about half of students receiving free and reduced price meals had lower odds of a wide cluster than schools with very few free and reduced price meal students. There was an 84% decrease in the odds of a wide cluster at schools with about half farm students. Now, there are some limitations in this analysis. First, there is missing data of school characteristics from schools that did not report in 2019 or schools that closed or merged with other schools. Second, there may have been schools that experienced a suicide death after 2019 that are not captured in our analysis. If one or more students died by suicide from a school in 2020 or 2021, we have not captured that in the identification of point clusters. And third, to more accurately predict and prevent suicide clusters, we will need to know what differentiates a cluster school from a school that experiences only one suicide death. One suicide death is tragic, and suicide is preventable. But having more than one suicide death from within the same school in a short time frame can be devastating for students, staff, parents, and community members. So what does all of this mean? What can we really do to predict and prevent suicide clusters? Well, we know a lot about individual level risk factors for suicidal ideation and death, but we know very little about the mechanisms behind how point clusters actually form. In this figure, authors Gustavo Turecki and David Brent present an individual level model for suicide risk. The clinical predictors of suicide are illustrated here in the green spaces. Some examples of individual level risk factors are genetics, mood and personality, and life events. But when we frame this model within a public health approach, we look at the environmental and sociocultural context around the individual. That's illustrated here in the purple spaces. How do we protect individuals and the student body from factors that contribute to suicide risk in their schools, in their communities, in their peer groups, and in other social influences? My project focuses on the purple spaces in this diagram. To help answer these questions, I created a systems level model for suicide point clusters. Here you can see the primary pathway between the first suicide death in a community and the impact that has on the school student body. When this impact combines with individual level risk factors for suicidal ideation, it may lead to a subsequent suicide death in a point cluster. But when you situate this within the response at the school level and the community level, the diagram tells a different story. At the school level, schools can use postvention strategies after a student's death, which can support the bereaved student body with the tragic loss of their friend or peer. We can combine this with community-based mental health structures and support systems that will create a supportive and mental health affirming network around the school community. Together, we can disrupt the pathway that leads to subsequent suicide death in point clusters. School community partnerships will help identify the areas that we can modify in the social networks and the environmental context to prevent suicide clusters from ever forming. Postvention can act as prevention for further suicides, but we don't need to wait for the sentinel death. Suicide prevention can prevent one or multiple suicide deaths, but together with a coordinated, multi-tiered, cross-sectorial approach, we will be able to prevent further suicides. Together, we can create a culture that prioritizes mental health, student well-being, and family success. We can shift the cultural acceptability of suicide so that it is no longer an option for students. And together we can do better to support students, staff, parents, and community members. And the time is now. With that, I thank you for your attention during my presentation, and I welcome your questions or feedback. I can be reached at taylor.binnix@jhu.edu. Thank you.